Good morning. Welcome back to Open Med School. Today we will be discussing the functional anatomy of urinary system. The urinary system consists of the kidneys, the ureters, urinary bladder and the urethra. Kidneys are bean-shaped organs which approximately weighs around 150 grams and 10 to 12 centimeters in length, 5 to 7 centimeters in width and 2 to 3 centimeters in thickness. It is situated retroperitoneally at the vertebral level T12 to L3. Here you can see this is an MRI picture which shows the kidneys. The left kidney is at a higher level compared to the right kidney and it has got a bean shape. The kidney has got three coverings. First is the renal capsule, surrounding which there is a perinephric layer of fat, and then comes the renal fascia. So kidney has got three coverings. This is the diagrammatic representation showing this is the kidney and here is the perinephric fat and then comes the renal fascia. In the MRI picture you can clearly see this. That is this dark region surrounding the kidney is the perinephric fat. Internally kidney has got three parts. The outermost part is the cortex. The inner part is the medulla. Medulla has got this pyramidal shaped structure, the medullary pyramids and the renal pelvis. The hilum is the region, it is a concave part of the bean shaped kidney where blood vessels and nerves are entering and exiting the kidney. From here the ureters are also going down. So this part is called the hilum of the kidney. What is the difference between hilum and renal pelvis? Hilum opens into the renal sinus. So this part is the hilum, it opens into the renal sinus which includes the renal pelvis and the vessels. And the renal pelvis leads on to the major and minor calyxes. So here you can see the hilum. This part which contains the blood vessel is the renal sinus and the renal pelvis leads on to the major and minor calyxes. About the lymphatic supply, the lymphatics are absent in the medulla and the lymphatics contain a lot of erythropoietin and they are drained via the thoracic duct. So in summary, the kidney has got an outer cortex, the inner medulla. The medulla has got the renal pyramids and between the pyramids part of the cortex is entering and this is called the renal columns, and through the renal columns the blood vessels are reaching the cortex. And the renal pyramid opens via the papillae. Papilla means nipple. So through the papilla it enters the minor calyxes. The minor calyxes join together to form 2 or 3 major calyxes. They are the upper, middle and lower calyxes. And this shows the urinary system, the kidney, the vessels, the ureter, the bladder and finally the urethra. And two important diseases we should remember. One is the renal stone, or is called nephrolithiasis. When it moves down the ureter, it produces severe pain. That pain is called renal colic. And renal colic has got a characteristic distribution. It's an excruciating pain starting in the loin region and goes down to the groin. So it is called loin to groin pain. and sometimes infection can occur in the kidney. Infection of the kidney is called pyelonephritis, that is pelvis pyelonephritis. And sometimes cysts can occur or tumor can occur. So here you can see multiple cysts are there. This is part of the disease called the polycystic kidney disease. And the functional unit of the kidney is nephron. In the next session, we will be discussing about the parts of nephron and the functions of nephron. Hope this was useful to you. Thank you.